సో మనకి ఈరోజు టాపిక్ ఏంటంటే థైరాయిడ్ అండ్ పారాథైరాయిడ్ గ్లాండ్స్. సో ఇప్పుడు thyroid gland and parathyroid gland, both the glands are endocrine glands. It is called as gland. Okay, it is an endocrine gland, endocrine or ductless gland. Means, yeah, they pour the secretions directly into the blood. And these secretions are called as hormones. The secretions from endocrine glands are called as hormones. These are ductless glands, right? Yes. So both thyroid and parathyroid glands are endocrine glands. So the meaning of thyros in the thyroid gland is shield. Thyros, shield, and edidose. Okay, edidose is form. It is like a shield like. Okay, and it is the largest endocrine gland of the body. So we are saying that it secretes some secretions directly into the blood, and those secretions are called as hormones. So which hormones are secreted by this thyroid gland? First let us see about this thyroid gland. Okay, so what secretions are secreted? What hormones? Yeah, the thyroid gland secretes 3 hormones. What are those 3 hormones? Yeah, first T3, T4 and calcitonin. Okay, these are the 3 hormones secreted by our thyroid gland. So they mainly, so functions of thyroid gland, it also has 3 functions. Yeah, it regulates BMR, basal metabolic rate, right? Next, second, psychosomatic growth of body. Means general growth of body requires these secretions or these hormones, especially the skeletal muscle and neural network. Especially these two requires the hormones, right? Next, okay, so the hormones are T3, T4 and calcitonin, and the functions are regulation of BMR, psychosomatic growth of body, especially the skeletal muscle and neural network. And the third important function is that important role in calcium metabolism. Yeah, by calcitonin. Okay, calcitonin mainly regulates this calcium metabolism. Okay, so the 3 hormones and their functions. Okay, so this is about the thyroid gland as an endocrine gland. Now if we see the location of thyroid gland, so thyroid gland is located in the lower part of front of side of neck. So lower part of front and side of neck, and opposite to C5, C6, C7 and T1 vertebrae. Shortly C5 to T1. Okay, Next is uh, it clasps the upper part of the trachea around the upper part of trachea. Here is the location of thyroid gland, right? It is clasping the upper part of the trachea. Trachea starts from here and upper part of, yeah. So it is at the side of neck and lower part of neck, front of neck. So here this is a hyoid bone, this is a ligament, and here is the thyroid cartilage. Here is a two laminae of thyroid cartilage forming the singular one. Next, this is the cricoid cartilage, and here is a trachea and thyroid gland. What is the shape here we can see of thyroid gland? Thyroid gland is H shaped, okay. And these are the two sternocleidomastoids from sternum to mastoid process of neck, of behind the auricle or the ear, right? Yes, so that is about thyroid gland. So if we see weight and dimensions and all, it is H shaped, right? And if you see weight of thyroid gland is 25 grams, and height is about 5 centimeters, and breadth, not the breadth, but width is 3 centimeters, and thickness is 2 centimeters of, actually, next, this height is of, these are of lateral lobes. So what is this lateral lobe? Let us see. And next is isthmus. Is 1.25 centimeters both vertically and transversely. So, and size of thyroid gland increases during pregnancy and menstruation. Okay, physiologically, not pathologically, but physiologically. Okay. Next, what is this lateral lobes and isthmus? Let us see. Okay. So here is a thyroid gland, this yellowish gland, right? So here these two are the lateral lobes, and this one is the that connects the both lateral lobes laterally, which are placed laterally. That is connected by the isthmus, the horizontal one. Okay. So if you see the dimensions and all, weight is 25 grams. Okay. And height of this lateral lobe is 5 centimeters, and width is 3 centimeters, and thickness, the height, not that height, but the thickness is 2 centimeters anterior posteriorly. Okay. And isthmus, the isthmus here horizontally and vertically it is 1.25 centimeters. Okay. And the size of thyroid gland increases physiologically during pregnancy and menstruation. Next, special features. Let's see special features of thyroid gland. It is located only endocrine gland, located superficially and accessible for physical examination by the clinician. Okay. It is the only endocrine gland. Not all endocrine glands are deep, but it is the only endocrine gland located superficial and accessible for physical examination. Okay. So next is, that is the one of the special feature, and next special feature is only endocrine glands, only endocrine gland that depends on external environment on raw material. What is the raw material for synthesis of T3 and T4 hormones? Of course, iodine is required, right? Iodine is supplied through diet. Okay, so it is the only endocrine gland that depends on external environment for raw material. Okay, next, only endocrine gland doesn't stores and releases when needed. So when after the formation of T3 and T4, generally every endocrine gland, whatever the hormone it has to produce, whatever hormone it has to secrete, it will produce that hormone and immediately secretes it directly. It doesn't store. But thyroid gland is the only endocrine gland that forms the T3 and T4 and stores for some time and releases the hormone whenever necessary. Okay. Next, it is one of the organ having very rich blood flow. Okay. So these four are the special features of the endocrine gland. What is that? First is enhance, only endocrine gland superficially located, so available for physical examination, and only endocrine gland depends on external environment for raw material, that is iodine. Next, only endocrine gland stores and releases the hormone when needed, and it has very rich blood flow. Okay, this is about the special features. So if we see paths and features, like normal features of thyroid gland, so it is H-shaped first, right? So next is that, so this is isthmus. These are the two lateral lobes, right lateral lobe and left lateral lobe. Okay, so and isthmus connecting both the right and left lateral lobes, and sometimes there will be a pyramidal extension on the isthmus on its superior border, and that is called as pyramidal lobe. Okay, sometimes it is present, if it may or may not be present. And this pyramidal lobe, it is connected to the hyoid bone by a ligament called levator glandulae thyroideae. Not even a ligament, it is just a fibromuscular band. So it connects hyoid bone by fibromuscular band. And what was that? Levator, that means lifting. Glandulae thyroideae, what does it lift? Glandulae. gland. Which gland does it lift? Thyroid here. Okay. So this pyramidal lobe connects thyroid gland to the hyoid bone by fibromuscular band called levator glandulae thyroideae. Yeah, between pyramidal lobe and hyoid bone, right? Yes. Next is that the thyroid gland, in this thyroid gland the isthmus part is in front of second, third, fourth tracheal rings. Okay. And the lateral lobes, the two lateral lobes, they extend upward and a bit lateral, okay, than the usual. So here they extend up to thyroid cartilage, oblique line of thyroid cartilage. Okay. And below they extend up to the fifth or sixth tracheal ring. Okay. Okay. So isthmus is in front of, not up to, but in front of second, third, fourth tracheal rings. Okay. And the lateral lobes extensions, we are talking about the extensions. So upper superiorly up to oblique line of thyroid cartilage, right? And inferiorly up to fifth, sixth tracheal rings. Okay. So if we see the isthmus, yeah, this is the pyramidal lobe, if you can appreciate it. Yeah, here is a pyramidal lobe, and there was a fibromuscular band, that is levator glandulae thyroideae, that is attached to the hyoid bone, right? And these are the two lateral lobes. This is the isthmus, and isthmus is in front of 2, 3, 4 tracheal rings, and the lateral lobe up superiorly extends up to oblique line of thyroid cartilage. This is a thyroid cartilage, okay, this one is a thyroid cartilage, and oblique line of thyroid cartilage, this is the oblique line. So up to oblique line of thyroid cartilage, and inferiorly up to fifth or sixth tracheal rings. This is the extension of lateral lobe, isthmus, 2, 3, 4 tracheal rings, right? Yes. Next is that capsule of thyroid gland. So the thyroid gland has two capsules. The outer, the outer or the false capsule, and the inner or the true capsule. Okay. And these are the venous plexuses deep to the true capsule. So what are these capsules? Let us see. Capsules are meant for protection, right? And also there are two capsules, true capsule, inner, okay, and false capsule, outer. So this true capsule is formed by condensation of stroma of gland. Okay. So every gland of our body has both true capsule and false capsule. Okay. So these two capsule helps in protection, and also like this true capsule always is inner, and it is made up of condensation of stroma of gland. For example, if you take kidney or any other gland, true capsule and false capsule will be there, and true capsule is always made up of condensation of stroma of gland. That is fixed, okay, and it is always inner one, that is fixed. And if you come to a false capsule, it varies everywhere, okay. So this is the outer capsule. So it is not it is formed by splitting of pretracheal fascia. So what is this pretracheal fascia? Let us see. This pretracheal fascia is a layer, or deep fascia. It is a deep fascia. Deep fascia actually has 3 layers: investing layer, pretracheal, and prevertebral fascia. Okay, these are the 3 different layers of deep fascia that is covering the structures. Okay, investing layer actually covers the muscles, and pretracheal fascia is covering thyroid gland and other anterior structure, or the trachea and esophagus, carotid sheath and all. And prevertebral fascia covers the vertebrae. Okay, yeah. And the fascia of neck is called fascia collis. Okay. Next is that if we come to this capsule of thyroid gland, here this capsule is actually false capsule. The true capsule is uniform all over, but false capsule is not like that. It varies. So posteriorly it is thin, and medially and lateral medial surface of lateral border, it is thick. On the medial surface it is very thick, that it forms a suspensory ligament of Berry. So this suspensory ligament of Berry attaches to the it attaches the cricoid cartilage. So medial surface, the false capsule at the medial surface is very thickened and forms a suspensory ligament of Berry, and which attaches to the cricoid cartilage. Because of its attachment to the cricoid cartilage, whenever we swallow the food, our thyroid glands also, along with the cricoid cartilage, it moves up and down movements. We can see that, okay. So here the posteriorly the layer is thin, right? So it is very easy, whenever there was a thyroid enlargement or goiter, the enlargement can't it can't enlarge on the medial surface, because the the false capsule is thick on the medial surface. So it enlarges posteriorly, as the false capsule there is thin, okay. So it bulges posteriorly, causing 3Ds. What is this 3D? Let us see in the further of the class. Next is that relations of thyroid gland. And before that, so here is a thyroid gland, and this thyroid gland is covered by, of course, the true capsule, the inner one, and here is a false capsule, okay. So uh, deep venous plexus. These are the deep venous plexuses. Okay, these deep venous plexuses are placed deep to the true capsule. This is the true capsule. Okay, deep to the true capsule are the venous plexuses. So here, whenever there was a thyroidectomy, if they just remove the thyroid gland, leaving the deep plexuses intact in our body, it causes hemorrhage. Okay, it causes hemorrhage. So they have to remove these venous plexuses also to avoid this hemorrhage. Thyroidectomy means when there was an enlargement or any problem or any tumor of the thyroid gland is removed. Okay, so during thyroidectomy, these deep plexuses are to be, of course, removed with the thyroid gland, or it causes a hemorrhage. So they are deep to the true capsule. So the thyroidectomy, the incision by the surgeon is done around the true capsule. It leaves, so they leaves the false capsule intact in our body and removes the thyroid gland along with the true capsule, so that there won't be hemorrhage caused. And if there was hemorrhage, yeah, the person goes into hypovolemic shock and it leads to serious consequences. So to avoid that, the surgeon takes an incision between true capsule and false capsule. But in case of prostate gland, as I told you, every gland has two capsules. So prostate gland, which is especially in males, it is present only in males, it is absent in females, right? Yeah, it do have true capsule and false capsule. Okay, true capsule and false capsule. But here the venous plexuses are, yeah, so so here the venous plexuses are not like thyroid gland. They are present, yeah, here. Yeah, their venous plexuses are present between the true and false capsules. Okay, so whenever the surgeon takes prostatectomy, removal of prostate gland due to tumor or any other reason, they give incision, yeah, deep to true capsule of prostate gland. So only prostate gland is removed by the surgeon, and true and false capsule along with their deep venous plexuses are intact in our body. Okay, so it doesn't cause any hemorrhage because it is not touching the venous plexuses, but it is in case of, yeah, prostate gland. Okay, but here in the thyroid gland, it is these venous plexuses deep to the true capsule. So if they cut it, it causes hemorrhage. So they are taking it off with the true capsule so that there won't be any hemorrhage. So false capsule is left intact. Here both true and false capsule are left intact. Okay, that is the difference between thyroidectomy and prostatectomy. And the placement, the difference is due to the, yeah, the placement of deep venous plexuses. Okay, yeah, in between true and false capsules in prostate gland and deep to true capsule in thyroid gland. Okay, next is that relations of thyroid gland. If we see relations of thyroid gland, so first let us see presenting parts of thyroid gland. So what are these presenting parts? What are the surfaces and borders and all? Let's see. So first there are parts of thyroid gland. Lateral lobes. How many are there? Yeah, two, right and left. Okay, and the isthmus. Okay, so if we come to the presenting parts, first we have in the lateral lobes apex, base. and 3 surfaces and 3 borders. Sorry, 2 borders. Okay, so what are these 3 surfaces and 2 borders? Let us see. And isthmus have 2 surfaces and 2 borders. So the apex and the base of the thyroid gland. Apex and base. As I told you, apex extends up to the oblique line of thyroid cartilage, and base up to 5th or 6th tracheal rings. Okay, we have to remember this. It's compulsory. So what are the 3 surfaces? Let us see. Three surfaces are lateral surface, anteromedial surface, and posteromedial surface. So the 3 surfaces are medial surface, anterolateral surface, and posterolateral surface. Okay, so for example, if you take this as a one lobe, here I'm representing this lobe with this. Okay, so if you take this as a one of the lateral lobe of the thyroid gland, especially the right one, so if you see towards my palmar side, this one, the palmar side, this is the medial surface. This medial surface, the false capsule, how is it related? The false capsule of this medial surface is thickened, very very thickened, that it forms a suspensory ligament, suspensory ligament of Berry, which attaches to the cricoid cartilage, that causes up and down movements of the thyroid gland along with the swallowing. Okay, so this is the, towards my palmar surface is the medial surface, and towards my dorsal surface is the here we can see the, in the video you can only see the medial surface. This is the not medial surface, only the lateral surface. All of this is lateral surface, the dorsal part, but from this view you can only see anterolaterally the the front one, right? Anterolaterally, and behind it is the posterolaterally. Okay, so this is the medial surface of thyroid gland lateral lobe, and here is the anteromedial surface, right? Sorry, anterolateral surface. This is medial surface, the complete one. Okay, this is the anterolateral surface, and this is the posterolateral surface. Okay, so these are the surfaces of 3 surfaces of thyroid lateral lobe. And what are the 2 borders? Here this border is the anterior border, this front one, and along my index finger or the thumb finger, and along my little finger is the posterior border. So 2 borders and 3 surfaces. Okay, did you get that? Yes. So, and isthmus, if you come to isthmus, here it has 2 borders, as you can see in the picture, the upper border or the superior border and the lower border, right? In the upper border only you can see this pyramidal lobe, which is attaching the which is attached to the hyoid bone by levator glandula thyroidea. Okay, so this is the superior border of the isthmus and inferior border, 2 borders of isthmus, and this outer external one is the external surface, and the inner one is the, that side from that view is the inner surface. Okay, so two surfaces are external surface and internal surface, and two borders are superior border and inferior border. Okay, these are the presenting parts of uh, thyroid gland. In first, lateral lobes has apex and base, and three surfaces and two borders. Anterior border and posterior border. Okay, and isthmus has two surfaces, external and internal, and two borders, superior and inferior. Okay, now we'll see the relations. Okay, so yeah, so here is the apex, right? Apex of thyroid gland, which is upward and a bit lateral, if you can see, and the muscles attached on the oblique line of thyroid cartilage are actually thyrohyoid, sternohyoid, and inferior constrictor. Let us see them later. So before that, let us see relations. If you come to relations, the apex, this is the apex, it is sandwiched between two muscles. What are those two muscles? Medially it is inferior constrictor, okay, and laterally inferior constrictor of pharynx, and laterally it is sternothyroid. Okay, so there are two muscles between which there was a apex of thyroid gland. It was sandwiched between two muscles. Medially inferior constrictor of pharynx, and laterally sternothyroid muscle. So what is this sternothyroid muscle? Sterno means sternum. Thyroid means it is going to the thyroid cartilage, attaching to the oblique line of the thyroid cartilage. So sternothyroid and inferior constrictor of pharynx. These both attaches to the oblique line of thyroid cartilage, and between them is the apex of thyroid gland, lateral lobe. So if there was a bulging of thyroid gland or goiter, simply the bulge cannot be extending medially or laterally or upwards, because these muscles are strong and it cannot bulge out like that. Okay, so the bulging will be posteriorly mostly, okay, or downwards. Okay, so and here as you can see, this is a thyroid cartilage and cricoid cartilage and tracheal ring starts like that. Okay, and apex is related to one artery and one nerve. Apex is related to two muscles, right? One artery and one nerve. So what is that artery and nerve? Let us see. So the artery is superior thyroid artery, and the nerve is external laryngeal nerve. Okay, so what is the superior thyroid artery? Where does superior thyroid artery is coming from? Let us see in further session of the class. Superior thyroid artery, to simply say, is a branch of external carotid artery. Okay, next, this is about the apex and relations of apex and base. If you come to base of the thyroid gland, of the lateral lobe, it is extended up to fifth or sixth tracheal ring, and as I told you, okay, and it is related to one artery and one nerve. So if you come to artery, it is inferior thyroid artery, and nerve is recurrent laryngeal nerve. Okay, here the base is related to inferior thyroid artery, apex is to superior thyroid artery, and inferiorly the nerve is recurrent laryngeal nerve, and apex is the nerve is external laryngeal nerve. Okay, and next is lateral or superficial surface. If you come to lateral surface, so this is a lateral surface, okay, and this is a medial surface. Okay, this is a superficial surface or the lateral surface. It is yeah, uh, related to three muscles. Okay, and here if you can see, here this is a green layer around this muscle. This is a sternocleidomastoid muscle. Okay, these two, and these two muscles are wrapped around a green color fascia, and this one is a, yeah, investing layer of deep cervical fascia. Okay, deep deep fascia, we have skin, superficial fascia and deep fascia, right? Deep fascia is again of three layers, something like investing layer. And yeah, here is the pretracheal fascia of deep fascia surrounding the thyroid gland, and prevertebral fascia will be coming here, but it was not presented here. Okay, yeah, here it is the prevertebral fascia. Okay, just represent. So these are three parts of the deep cervical fascia. Okay, surrounding the structures. So yeah, lateral surface, the relations are three muscles and three deep muscles and one superficial muscle, that is a sternocleidomastoid. And from deep to superficial, this muscle is sternothyroid, then is omohyoid superior belly and sternohyoid and sternocleidomastoid. These are the four muscles covering the lateral surface of thyroid gland. Okay, so first is skin, right? Superficial fascia, then sternocleidomastoid, then sternohyoid muscle and superior belly of omohyoid muscle, as you can see, and sternothyroid. Then you can see the, if you take all these layers out, then only you can see this thyroid. Okay, so next is medial surface. Medial surface, yeah, the surface towards the trachea and esophagus. And see here, this is the thyroid gland, trachea, esophagus. Okay, this thyroid gland, sorry, not the thyroid gland, but the trachea. This is a C-shaped cartilage, and this is the tracheo ligament, tracheobrachialis ligament. Sorry, tracheoligmentalis ligament. Next is that from the trachea. So medially, we can see this. Trachea and esophagus, and actually, yeah, two tubes we can see. It is called as tubes. All are tubes. Two tubes we can see medially, medial surface, trachea and esophagus, and two muscles, inferior constrictor and cricothyroid muscles, but it is not seen here. Yeah, here we can see. Yeah, two cartilages, two tubes and two muscles. Medial relations are like this: two cartilages, two tubes and two muscles. So cricoid cartilage and thyroid cartilage, esophagus and trachea, two tubes, and two muscles are inferior constrictor and cricothyroid muscle. Okay, these are the medial relations. And here if you see the apex is related to the superior thyroid artery and external laryngeal nerve, and base, it is related to the recurrent laryngeal nerve and inferior thyroid artery. Okay, so apex base ho gaya, medial surface to tubes, two cartilages, two muscles ho gaya, and lateral surface is by covered by four muscles, that is from deep to superficially. First is yeah, sternothyroid, from sternum to thyroid oblique line of thyroid cartilage, sternohyoid from sternum to hyoid bone, and then omohyoid superior belly, and sternocleidomastoid most superficially. Okay, next is that, yeah, here if you see, the carotid sheath is posterior. Here if you see this false capsule, the pretracheal fascia, here there was a dotted line. Here the anterior it is normal line, but posteriorly it was a dotted line representing that the pretracheal fascia of thyroid gland posteriorly is thin. Okay, and this is the parathyroid hormone. These parathyroid hormones are on the posterior side of the thyroid lateral lobe. And next, posterior laterally, these are, yeah, anterior laterally, they're anterior, right? And here is a posterior laterally. Posterior laterally, the related structures are carotid sheath. And what does this carotid sheath consist of? Carotid sheath consists of three structures here. Okay. The first one is internal carotid artery and common carotid artery. Okay, from the common carotid only internal carotids. Okay. Next is internal jugular vein, and between both of them and a bit behind is the vagus nerve. Between them. Okay. And a bit behind is a vagus nerve. And it is covered by carotid sheath. And this is a fourth part of the fourth layer of the deep cervical fascia. Okay, so this is about the posterior lateral relations. Anterior lateral, posterior lateral, medial, apex and base ho gaya, right? Next is anterior border is thin and separates superficial and medial surface, and posterior border is thick and rounded, separates medial and posterior surface. So here along my thumb is the anterior border. It is, what does it is separating? Yeah, this surface and this surface, my palmar surface and a bit of dorsal surface, right? So it is separating, the anterior border separating the medial surface and the anterior lateral surface, and my posterior border is separating the other part of the dorsal surface, right? So posterior lateral surface and the medial surface. Okay, so this is about the presenting parts of lateral lobe. Okay, apex, base, three surfaces and two borders. Okay, next, isthmus. It has two surfaces and two borders. Okay, and if you come to isthmus, anterior surface, and also I forgot to tell you one thing, I forgot to mention one thing, is that anterior border, posterior border. Posterior border is related to, I think it is not present in this one. Let's see. Yeah, so here it is the common carotid artery, and here is the internal carotid artery, and here is the external carotid artery. The smaller is external one. So from the external carotid artery, it is divided into two branches: anterior descending branch and posterior descending branch. Anterior descending branch of the opposite side also, both of them anastomose the superior thyroid artery. This is a superior thyroid artery, right? Common carotid, internal carotid and external carotid. From the external carotid is superior thyroid artery, and from superior thyroid artery is anterior descending and posterior descending. Okay, so the two anterior descendings of superior thyroid artery, or the anastomosis of both the superior thyroid arteries, happen along the superior border of the isthmus. Okay, right? And the posterior branch of the superior thyroid artery and inferior thyroid artery, one of the branches of inferior thyroid artery, both of them anastomose along the posterior border of the thyroid gland of lateral lobe. Okay, so longitudinal anastomosis of superior thyroid artery and inferior thyroid artery and parathyroid glands are relations of posterior border. It is thick and round. So okay, these are the relations of posterior border. Okay, next is isthmus superior border relations ho gaya already, right? Next, anterior surface, inferior border. If you see inferior border, thyroid vein, inferior thyroid vein emerges, and thyroidemia artery, if it is present, it enters. And this thyroidemia artery is not always present, it is occasionally present. And if it is present, it may be from the brachiocephalic trunk. This is the brachiocephalic trunk, dividing into subclavian artery and right common carotid artery, right subclavian and right common carotid. And from the brachiocephalic trunk, there will be a extra branch, that is thyroidemia artery. If present, it is from the it comes from the below, or sometimes it may even come from the arch of aorta directly. Okay. And inferior thyroid vein is also present along this inferior border of isthmus. Okay, these are the relations of borders of isthmus. And surfaces, if you see anterior surface, the surface which we see, it is related to strap muscles. And what are those strap muscles? Sternothyroid and sternohyoid muscles. There are other strap muscles also, but it is related to two strap muscles, sternothyroid muscle and sternohyoid muscle. So what does this strap muscle mean? These strap muscles extend from sternum to, to the face, and they form strap like, so they're called as strap muscles. There are approximately 4 or like that. Okay, covering the structures and protecting them of neck. Okay, next, anterior jugular vein are the relations of anterior surface, and posterior surface is related to 2, 3, 4 tracheal rings. That's it. Okay, next is arterial supply. And relations, if I summarize quickly: apex to muscles. What are those muscles? As I told you, write them yourselves. And next is, sandwiched between 2 and 1 artery and 1 nerve. Try to complete this. And next is base is really, and extent also. Okay, this is the assignment or homework, whatever. And next is a base. Base is related to 2 tubes, one artery and 1 nerve, and extent. Okay, and medial surface, it is related to 2 tubes, 2 cartilages, and 2 muscles. What are those? Next, lateral surface, anterolaterally, 4 muscles, right from deep to superficially. Okay, next, posterolaterally, posterolateral surface, we can see carotid sheath, their contents. There are 3 contents. And next is parathyroid hormone, gland. Okay, and posterior, anterior border, separates which surfaces you have to write. Okay, and posterior border separates, and it is related to an anterior border related to anterior jugular vein. Okay, anterior branch of superior thyroid artery. Okay, I forgot to mention it before. So posterior border is related to two things. Anastomosis. What was the anastomosis between? Okay, and next is parathyroid gland. Okay, so complete this. And next is isthmus. This is just about the lateral lobe and isthmus. Yeah, the superior border anastomosis is related to anastomosis between which two arteries, and next inferior border. Yeah, it is related to two structures, one vein and the other is the artery, and its origin varies. What are those origins? Okay, that is about the relations of thyroid. If we come to arterial supply, so arterial supply, first if you see this here, this is arch of aorta, right? And this arch of aorta gives three branches. So what are these three branches? First, from the leftmost is the left common carotid artery and left subclavian artery, and towards the right is the only one branch, that is brachiocephalic artery. Okay, oh sorry, not artery but the trunk, because it divides further. Okay, brachiocephalic trunk. So 1, 2, 3. Okay, these are the branches of arch of aorta. So left common carotid and left subclavian are direct branches of arch of aorta, but from the right here, from the brachiocephalic trunk, which is a branch of arch of aorta, from there it divides into right subclavian artery and right common carotid artery. Okay, right common carotid and right subclavian artery. Okay, so this right common carotid or the left common carotid, how they proceed, let us see. So whatever the right or left common carotid, whatever the carotid artery is, the common carotid artery passes upwards towards the neck, and while it is passing, it splits into internal and external